Can you hear?
Hi. Good evening. Yes, I can hear you.
Welcome and good evening, everyone. My name is Sarah Fatia, and I will be the baby for this session. With me today is Siti Nurhanis binti Harman as the assistant baby and Nurul Akila binti Mursalin as the timekeeper. We will begin the round whenever you are ready.
Maybe 5 minutes before we start. 5 minutes. Okay, are the participants ready, or you guys would like to start sharp at 2 p.m.? Maybe I should ask the participants. So, Ainin, Sophia, who are the participants here? Ainin, Sophia, Lina, Mias, Mai, Sarah, Nur Aisha, Saleha, Amalin, Husna. Are you all ready to start in 5 minutes time, or you guys would like to wait for 2 p.m.?
5 minutes will be okay.
5 minutes will be okay. Okay, because I'm gonna take my water first.
Thank you.
Yeah. So are you ready,
Yes, we are.
participants? Okay, you're ready? Okay, I saw familiar faces here. Namay Sarah, Ainin, Sophia, Lamin, Aisha. Okay, so all right, so I'm ready. Can we start? At your convenience. Okay. Okay, so So belief.
This court is now in session. The judge for the session is Ms. Anis binti Zulkafli. The appellant is represented by Lina Maisara binti Amyamin and Ain Sofia binti Azlaini, while the respondent is represented by Nur Aisha Soliha binti Zainal Abidin and also Nur Amani Husna binti Muhammad Nazir. Counsels for the appellant and the respondents are each allocated 40 minutes to present their respective cases, which is inclusive of a maximum of 5 minutes each for their rebuttals and rebuttals respectively. We will now invite the first oralist to begin their submission.
Good evening. Before I begin, am I audible?
Yes.
Much obliged. If it pleases the Honorable Court, my name is Lina Maisara and I appear before the court today with my learned counsel, Ms. Ainin Sofia, representing the appellant, Mrs. Amrita, daughter of Ramasamy, in this matter. Representing the respondents, Ms. Nur Aisha Soleha as the senior counsel and Ms. Nora Amalin Husna as the junior counsel. Your Honor, before I proceed, do you need summary of the present case?
Yes, please.
Much obliged. Your Honor, in the present case, the appellant felt numbness and further consulted the first respondent, a medical consultant of Nilai SMX Medical Center, which is in this matter the second respondent. The first respondent had made assumption that the appellant's numbness is a secondary progressive multiple sclerosis disease. However, the first respondent did not inform and advise the appellant on the seriousness of the numbness. Therefore, the appellant did not take seriously on her numbness. On 2018, the appellant moved to Sandakan. Since it is inconvenient to see the first respondent, the appellant consulted with Dr. Hans. Dr. Hans had suspicion on the numbness happened, and it turned out that the appellant had a primary progressive multiple sclerosis. Shocked with the information, the appellant agreed on the treatment administered to her. However, the appellant's condition worsens and affected her life. The appellant can no longer work because of her condition. She was also being informed that she cannot be cured. Devastated, the appellant brought this matter in the sessions court. Unfortunately, the respondents were not found liable. Therefore, Your Honor, this is where the present case comes into existence. Your Honor, this is an appeal case from the decision of the learned trial judge in the Sessions Court of Seremban. It is our submission that the learned trial judge has erred in his decision that there was no breach of duty on behalf of the first respondent, and the appellant has failed to prove the vicarious liability of the second respondent. We submit that this decision should be overturned. Your Honor, having done with my case theory, there are two issues to be submitted by the appellant. Firstly, the failure to advise is amount to breach the standard duty of medical consultant. Secondly, the second respondent is vicariously liable in protecting the appellant from harm or risk of injury. Your Honor, today I intend to deal with the first issue of appeal, and my learned co-counsel will deal with the remaining issue. Your Honor, we submit before the court that the first respondent is liable under the medical negligence on two grounds. First, the first respondent had breached the standard duty of medical consultant. And secondly, there was sufficient causation between the failure to advise and the damage suffered by the appellant, and this ground will be dealt accordingly. Your Honor, if there is no further question, may I proceed with my first submission?
Yes.
Much obliged. Your Honor, we submit before the court that the first respondent had breached the standard duty of medical consultant on 3 points. First, the first respondent had failed to advise the appellant. Second, the first respondent had failed to verify the initial diagnosis of the appellant's condition. And lastly, the first respondent had failed to refer the appellant to a specialist. Your Honor, according to the case of Fu Fiona and Dr. Su Fu Moon and another, which was decided in 2007, the Malaysian Federal Court had laid down that when a patient consults with a person possessed special skill and knowledge in medical treatment, that person owes a duty to the patient. And this duty, Your Honor, includes the duty to diagnose, the duty to advise, and the duty to treat his patient. In the present case, Your Honor, the relationship between the first respondent and the appellant come into existence when the first respondent consulted the appellant in October 2017. Thus, Your Honor, the first respondent is indeed bear the duty of care to the appellant. It is come to the dispute, Your Honor, that the standard duty of care is different according to types of profession. In the present case, Your Honor, as an independent medical consultant, the standard of care practices by the first respondent is expected to possess knowledge and skills for medical treatment, and this can be referred in the mood clarification, page 2, paragraph 3, page 2. My apology.
Which page?
Page 1, paragraph 2, question 3, where it states that an independent medical consultant is expected to demonstrate a particular level of knowledge and skills for medical treatment, and this lies to the first respondent. Hence, Your Honor, we submit before the court.
If I may stop you there, can you highlight this part on the paragraph 2 when Amrita, the appellant, had sought for medical consultation from Dr. Kevin, and then Dr. Kevin, as independent medical consultant, had considered that, in paragraph 3, Dr. Kevin had considered Amrita to have a secondary progressive multiple sclerosis. Isn't that sufficient to tell that Dr. Kevin had already exercised his duty of care?
Thank you for your concern, Your Honor. This will bring us to my first submission, which is the first respondent had failed to advise and provide necessary information to the appellant. Your Honor, this duty lies to the first respondent as if the first respondent, and if I may assist the court in the case of Gurisha Taranjit Kaur and Dr. Pramitya Damodaran and another, which was decided in 2020 in the Malaysian High Court, where in this case, the doctor is there with the duty to advise and provide necessary information to his patient. And this is to assist the patient to make choices for their treatment. Your Honor, in the present case, the first respondent failed to give any advice or any necessary information, despite having the knowledge, despite that he had made assumption and consideration that the numbness suffered by the appellant is a symptom of secondary progressive multiple sclerosis. Hence, Your Honor, the first respondent had failed on his duty to advise and provide necessary information to the appellant.
So, I mean, if I were the patient, when I consulted a doctor, and then when the doctor happened to inform or to tell me that, okay, you are considered to have a multiple sclerosis. And as a patient, I would definitely go and seek for a medical treatment, or I would have my own initiative to go for a further treatment rather than relying on the information, or rather than heavily relying on the advice or referral from Dr. Kevin. Because I think whatever that said by Dr. Kevin, multiple sclerosis is considered as a chronic disease. So as a reasonable patient, reasonable layman patient, whenever I heard that, oh, I might suffer from a multiple sclerosis, therefore and thereby I would straight away and go and seek for my own referral and seek for medical treatment. I think, in my opinion, I think that Dr. Kevin had already exercised his duty of care. Because if you know that multiple sclerosis is considered as one of the chronic disease, and it cannot be easily considered or easily diagnosed by any regular doctor, or be it like a house officer, for instance, or a junior doctor. So having the fact that Dr. Kevin had already come out with, even if it's not a final diagnosis on a medical report or something, I think that is sufficient to say that Dr. Kevin had exercised his duty of care. Your word of failure is, I think it's too bizarre to use here. How do you reconcile with that?
Thank you for your concern, Your Honor. This will bring us to my second submission, which is the first respondent had the duty to verify the diagnosis that was made by the first respondent towards the appellant's condition. Your Honor, if I may assist the court in the case of Sanmarkan, son of Ganapati and another, and Datuk Dr. Vitrai Singham and others, which was decided in 2012 in the Malaysian High Court. This court held that the consultant physician has the duty to make a further investigation of the disease medical condition, and the failure to comply with this duty constitute to breach the standard of care. Your Honor, in the present case, the first respondent had the knowledge that the numbness suffered by the appellant is a symptom of secondary progressive multiple sclerosis. He did has the consideration. That is the reason why the first respondent had suspected that the appellant may suffer from the disease. Indeed, however, the first respondent failed to take any further action to verify the assumption made by himself. Therefore, Your Honor, we submit that the failure of the first respondent to make a further investigation prior to his assumption or his diagnosis towards the appellant's condition has breached the standard duty of care.
Counsel, what is your opinion on the timeline of the final diagnosis of the appellant, Ms. Amrita, having his final diagnosis of bladder cancer and multiple sclerosis? Don't you think it's too remote, because the timeline here is between October 2017 and the final diagnosis came out when he had a brain cancer, even on July 2019. How do you respond to that? Because if I were in such situation, if I were the doctor, I wouldn't even foresee that my patient would suffer a different complications rather than only a multiple sclerosis, for instance, because you know that in a medical world, it's hard to foresee any other complications or any other symptoms or critical illness in the future. Plus, the timeline here is 2 years. Probably the medications or the treatment that has been undergone by Ms. Amrita in the current situation had constitute to the critical illness that she had suffered in July 2019. How do you respond to that?
Thank you for your concern, Your Honor. I would like to bring the court's attention in the medical article, which is Cancer Incidence and Mortality Rates in Multiple Sclerosis, which was written by Mary in 2021, which states that the multiple sclerosis patient is at high risk to suffer bladder cancer, in which commonly will cause neurologic complications or brain damage. Your Honor, in the present case, it is come to the knowledge of the first respondent that the first respondent had aware of the appellant's condition as a symptom of progressive secondary multiple sclerosis and has the duty to advise the appellant. However, he failed to do so. The advice that should be given to the appellant must be include the risk of having any compilation, because as I've submitted earlier, Your Honor, multiple sclerosis disease is a rare disease and chronic disease, meaning if the first respondent did not give any necessary information, then the appellant would not going to know what treatment or what risk that she would face on if she indeed had the disease.
What about just now you cited a medical journal? Was it medical journal? Medical article?
Indeed, Your Honor.
Medical opinion? Are we bound to follow medical opinion? Do you know that we are in the stage of appellate court? Do you know what is the jurisdiction of appellate court? Are we bound to follow medical opinion? Do you have a case to support? Do you have other cases to support your contention? Because I concede to the fact that, okay, fine. What did you say just now? it was one of the symptoms. It can constitute to a bladder cancer or a brain damage, but you cited a medical opinion or a medical journal. I'm afraid that the admissibility of medical journal can be used in the appellate jurisdiction, as if like you are trying to adduce a new facts or a new evidence.
Your Honor, if I may submit before the court Section 3 of Evidence Act, where the oral evidence or any document can be submitted to be documentary evidence, and this and also in Section 5 of the Evidence Act, the evidence given must be relevant to the facts and also the issue in the case. And Your Honor, we submitted before the court by submitting the journal article because the disease itself is rare in Asian descent. That is the reason why we use the journal article to give more exposure on the disease itself.
Okay, but I believe that Section 3 and Section 5 is only applicable for courts other than the Supreme Court, courts of appeal and federal court. Maybe it's in lower court, high court, during the trial or during the hearing, because we are now in the state of appellate court. So I believe that no facts or no new evidence should be tendered, because it's a, sorry?
Thank you for your concern, Your Honor. However, this is the High Court, since the first instant case was heard in Sessions Court of Seremban.
Session courts. Okay, but this is again appellate jurisdiction. I know that it is appeal from Session Court, bring up to High Court, but it is on the basis of appellate jurisdiction. So still, you might have to ask your mentor.
Thank you for your concern, Your Honor. My apologies for not assisting you in this matter.
Do you have anything else to submit on your first point, your first issue?
Yes, indeed, Your Honor. Your Honor, we submit before the court that the respondent also had failed to refer the appellant to a specialist. Your Honor, if I may be given extension time.
Yes, please. Conclude your submission. Maybe highlight on the important points and conclude your first issue submission.
Much obliged, Your Honor. So, as for the submission where the first respondent had failed to refer the appellant to a specialist, we refer to the case of Ahmad Takif Amza bin Ahmad Huzairi and Kuala Terengganu Specialist Hospital Sendirian Berhad and others, which was decided in 2021, where the Malaysian High Court held that the failure of the defendant to refer the plaintiff's condition to a specialist has resulted to worsen the plaintiff's condition. And in the present case, Your Honor, the first respondent had come into his knowledge about the secondary progressive multiple sclerosis disease and did not refer such condition to the specialist. As a medical consultant, Your Honor, it is expected for the first respondent to possess knowledge and skills for medical treatment. And the fact that he do know about the secondary progressive multiple sclerosis, meaning he do acknowledge that this disease is a chronic disease and must be referred to the specialist without delay. I would also like to assist the court in the expert evidence provided by the Professor Dr. Azran, whom a pathologist from Seremban Specialist Center, where according to him, if there was no delay in referral, the appellant would have 40% chance of remission. And this can be referred in page 2, paragraph 7. Your Honor, thus we submit that the first respondent had breached the standard duty of care as he failed to advise the appellant, had failed to verify the initial diagnosis, and then failed to refer the appellant to a specialist. That shall conclude my first ground, and I will shall proceed with my second ground. The appellant submits.
Okay, maybe we can give 3 minutes for you to submit. 3 to 5 minutes, okay, timekeeper, 3 to 5 minutes for you to submit your second ground, because I would like to hear your submission.
Much obliged, Your Honor. So the appellant submits that there was causation between the existence of negligence. My apology, may I rephrase my statement? The appellant submits that there was a causation between the failure to advise of the risk of the bladder cancer and the brain damage suffered by the appellant. Your Honor, in order to prove the existence of negligence, it is needed to prove the causation, that link between the negligence committed and the injury suffered. And we refer to the case of Ahmad Takif Amza bin Ahmad Huzairi and Kuala Terengganu, a specialist hospital Sendirian Berhad, which was decided in 2021, where the Malaysian High Court learned judge held that the defendant had failed to advise the parents on the seriousness of the plaintiff's condition, in which resulted to worsen the plaintiff's condition. So as I've submitted earlier,
Disease in that case, what is the chronic disease, or what are the illnesses suffered by the parties in that particular case?
The plaintiffs had a swallowed neck, and the defendant did not refer such condition to a specialist, which worsened the plaintiff's condition that resulted to brain damage.
Okay. Okay.
Your Honor, as I've submitted earlier, from the the first respondent had come into his knowledge that the first respondent aware of the appellant's condition and did know about the disease of the secondary progressive multiple sclerosis, and taking into consideration that the disease itself is rare, but the first respondent had knowledge on the disease, shows that he has the duty to give necessary information such as risk of any compilation or any treatment that will be given to her in order to her if he suffered the multiple sclerosis disease. Therefore, Your Honor.
Okay, Counsel, if I may stop you there. Can you please highlight the court on the nexus or on the relation between the initial symptom of multiple sclerosis, whether or not it's primary or secondary progressive multiple sclerosis, leading to or consequence or amount to the bladder cancer and the brain damage? Because I couldn't see any relation between having a initial or a minor symptoms of a secondary progressive multiple sclerosis to the brain damage. It's too remote. That's why I clarified you on my first questions earlier. It could be not because of on the default of Dr. Kevin, but it could be because of the when Amrita had undergo treatment few months or few years after that, and then she had to go through the CT scan and many types of treatment. I suppose that will lead her to the cancer, because you know that when you undergo through many X-rays and many CT scan, that will also can lead you to the brain cancer. It does not necessarily have to be the multiple sclerosis. How can you convince the courts about this? Because I am not really clear on your grounds of appeal.
Thank you for your concern, Your Honor. May I give in the extension time?
Yes.
Much obliged. Your Honor, the failure of the first respondent to advise, to verify the diagnosis and to make referral of such condition had actually worsened the appellant's condition, in which we can refer to in the mood problem, page 2, paragraph 7, where the expert evidence provided by Professor Dr. Azran that because of the delay in referral, if there is no delay in referral, she would have had remission chance of approximately 40%. Your Honor, in the present case, the bladder cancer, actually a disease that was spread by having the multiple sclerosis. This is because the multiple sclerosis affected the bowel of the appellant, which developed, which made the appellant suffered the bladder cancer, and the bladder cancer itself can actually develop to brain damage, and this has been proved in the article that I have submitted. So therefore, Your Honor, the
So,
failure of the first.
You're saying that having a mild or early symptoms of multiple sclerosis from having the numbness, so it can consequent to bladder cancer, and from the bladder cancer also it can lead to brain damage. Do you know what is bladder cancer?
Yes, Your Honor.
Do you know where is bladder? Where is our bladder located? I think it's too far and too remote from the brain. Unless you can give me any medical opinion just now, or like any cases that cited the medical opinion saying that having a minor symptoms of the multiple sclerosis and it can lead to bladder cancer, and it also relates or have the nexus to neurology that can affect the brain damage, then I can accept. Do you have any?
As I've submitted earlier in the medical article by Mary in 2021, which states that the multiple sclerosis patient is at high risk to suffer bladder cancer, in which commonly will cause brain damage, Your Honor. Therefore, had the first respondent given the advice upon the risk of the bladder cancer, then it will not going to lead or develop to brain damage, as the appellant can prevent herself from having the multiple sclerosis disease.
Okay, thank you.
Therefore, Your Honor, on behalf of the appellant, we submit before the court that the first appellant had breached his standard duty of care, and there is clear sufficient cause of the failure to advise and the damage suffered by the appellant. That shall conclude my submission. The remaining submission shall be continued by my learned co-counsel. Thank you for your time and indulgence.
Thank you, Lena. Okay, second counsel.
Good evening, Your Honor. Before we start our submission, am I audible?
Yes, you are audible.
Thank you, Your Honor. May it please the court. My name is Ainin Sofia binti Azlaini. I appear as the junior counsel on behalf of my client, Mrs. Amrita. Your Honor, in response to the senior counsel, we will be making on the second issue for this case. The second issue arises in this case is whether the second respondent is liable on the act of the first respondent, as the second respondent is vicariously liable for the act of the first defendant. Your Honor, we will now turn to our submission. The appellant submits that the second respondent has specialty on the plaintiff under the doctrine of non-delegable duty of care. Your Honor, to assist the court in understanding the doctrine of the non-delegable duty, the appellant defines the doctrine of non-delegable duty as a duty to ensure the work delegated to others is well taken care, whereby the person has power or control over that person. From the appellant's point of view, the second respondent has non-delegable duty, where it is under the second respondent's duty to ensure the work that has been appointed to the first respondent is conducted accordingly, despite of the first respondent being an independent consultant. Your Honor, to assist the court to have a better understanding in regards to this issue, I would like to bring the court attention in Dr. Kok Chong Sang and So Chang Lin and another appeal which was decided in the federal court in year 2017. In this case, the court found that the hospital has the authority to ensure the doctor who provide the service has necessary competence and expertise in doing the treatment. This is because due care should be exercised in the performance of the function by whoever is appointed to do so. Besides, in the case of Datuk Bandar Dewan Bandaraya Kuala Lumpur and Ong Kok Peng and another, the defendant owed non-delegable duty of care in ensuring that a contractor exercise his duty appropriately.
Counsel,
Your Honor, yes, Your Honor.
Are you submitting on the non-delegable duty of care or on the vicarious liability? Because I believe that it has two different components, vicarious liability or non-delegable duty of care. So which part are you submitting at the moment? Non-delegable duty of care?
Yes, Your Honor.
Okay.
May I proceed with my submission?
Yes.
Your Honor, much obliged, Your Honor. Your Honor, by implementing to this present case, despite of the first respondent rules as an independent consultant who is not attached to the second respondent, the second respondent still cannot escape that the liability to ensure that the service provided by the hospital is the safest and guaranteed services. This is because the treatment is conducted under the second respondent, and due to the negligence and misconduct made by the first respondent at the second respondent premise, the disease has developed into bladder cancer and brain damage suffered by the appellant. The liability to take care of the appellant cannot be solely passed to the first respondent, as the hospital also has its responsibility and control to ensure the duty is well provided by any person who has been appointed. Your Honor, if there is no further question, may I proceed with my submission?
Yes, please.
Much obliged. Your Honor, if we may assist the court in Woodland and Swimming Teachers Association and others, which was decided in Supreme Court in year 2014, the court held that the non-delegable duty shall include the duty of care and duty to ensure the care is well provided by the respondent. Furthermore, in Counties and States Transport Authority, which was decided in High Court of Appeal in year 1984, the court opined that the hospital had non-delegable to ensure the reasonable care and skill is taken by the person who have the responsibility to do so. To support this argument, we would like to assist the court in Roe and Minister of Health and another, which was decided in Queensland in year 1954. The hospital authorities is responsible for their staff, including anesthetists and the surgeons, despite whether the staff are permanent or temporary, resident or visiting or full-time or part-time. Your Honor, in applying to this current case, the second respondent has duty to give reasonable care to the appellant, as the appellant has sought medical treatment in the hospital due to the disease. The second respondent also responsible. Yes, Your Honor.
If I may stop you there, Mrs. Amrita went to the SMX Medical Center to look for Dr. Kevin, which happened to be her regular doctor. Okay, so how can you enlighten this court that the hospital is also related in this case?
Thank you, Your Honor, for your concern. Yeah, my apology, Your Honor. Can you rephrase your words?
Okay, so I was asking you that Mrs. Amrita, she made an appointment with the first respondent, Dr. Kevin, right?
Yes.
Okay, which Dr. Kevin is happened to be the independent medical consultant at the hospital. So can I conclude here that only Dr. Kevin is liable in this matter without involving the second respondent, which is SMX Medical Center? How would you respond to that?
Thank you, Your Honor, for your concern.
Yep.
If I may assist the court by referring to the Section 2 of the Private Healthcare Facilities Act 1968, where it stated that the private hospital is a premise who provide the medical treatment for those who have any disease or for those who have suffered any disease. So it is under the responsibility of the hospital itself to give its best treatment to the patient, to his patient, despite of the Dr. Kevin as an independent consultant. Have I addressed your concern, Your Honor?
I would concede you using that case, but there's not stated here whether is there any contractual obligations or whether or not any written agreement black and white between Dr. Kevin and also SMX Medical Center. It can be that he is just doing his locum, you know what locum is, or it can be that Dr. Kevin is merely an independent medical consultant. That means he does not really work full-time in SMX Medical Center. He only work independently on his own as the capacity of the independent medical consultant. So how do we include or how do we relate SMX Medical Center here?
Thank you for your concern, Your Honor. If I may assist the court, as mentioned in Section 16, Section 2 of Private Healthcare Facilities and Services Act 1998, it stated that in this section, when the hospital want to appoint the independent contractor or independent consultant other than the private premises, it shall get the permission from the Director General of the hospital itself. So in this case, we can see that even though the Dr. Kevin is an independent consultant, but the service or the consultant is made on the second respondent premise. So that must be some agreement that have been entered by this party. Have I addressed your concern, Your Honor?
I think you would have to rephrase your answer to that is a normal practice instead of there is an existence of agreement, because I was just giving you the situation. There's no agreement or whatsoever in the current in our current problem, but it's safe to say that maybe it is a normal practice of a medical consultant. Okay, so I was just assisting you. So all right, okay, good.
Thank you, Your Honor. May I proceed with my submission?
Yes, please.
Your Honor, in applying to this current case, the second respondent has duty to give reasonable care to the appellant, as the appellant has sought medical treatment in the hospital due to the disease. The second respondent is also responsible in making sure that the treatment was conducted accordingly, as the second respondent has the power to monitor the works. Your Honor, this is also in line with the definition of private hospital under Section 2 of the Private Healthcare Facilities and Services Act 1998, where it defines private hospital as a premise to give treatment and care for those who suffer from any disease. To support this argument, in the case of Vincent Manikam, son of David and others, and Dr. S. Hariraja and another, which was held in Court of Appeal in year 2018, the Honorable Judge found that a hospital or healthcare facility or service provider owes a duty to all the patients who attend or admitted to its care. By looking in our case, the appellant was in her vulnerable condition whereby she had a substantial numbness in her left limb and right limbs. My apology, right leg. For that reason, she needs to take the matter up to the first respondent who works as an independent consultant at the second respondent, and thus had special dependence on the second respondent in giving its bus services.
Okay, councils, let's see. Okay, let's see. If I am in favor of the appellant at the moment, I agree to your grounds of appeals and I allowed your appeal. If let's see, okay. So can I just decide that only Dr. Kevin is liable in this matter, not Nilai SMX Medical Center? Can I say that? How do you reconcile with that? Or do you still want to involve the second respondent here? Can we say that only Dr. Kevin is liable because he is a medical consultant? He bear all the duty of care, just like what your first appellant mentioned just now. He had breached his duty of care as he had failed to exercise, to give advice, to make a referral to the hospital. So now, if I were to allow your appeal, can I only decide that Dr. Kevin is the only person liable here, rather than Nilai SMX Medical Center? In your alternative arguments, how would you counter that?
Thank you, Your Honor, for your concern. If I may assist the court, based on the case of previous case that I have been mentioned, which is in Vincent Manikam, son of David,
Okay.
and Dr. S. Hari Raja and another, we submit that the hospital or SMX Medical Center is still liable based on this case, whereby the court found that the hospital or the service provider owes a duty of care to all patients who admitted or attend to the premise. So by referring to our current case, we can see that even though Dr. Kevin is an independent consultant, but the consultation is made under the premise of the second respondent. Thus, the second respondent the second respondent is liable because of the negligence or because of its negligence is making sure that the service is provided accordingly.
So you're saying that despite Dr. Kevin is a liable individual here, the second respondent, which is SMX Medical Center, should also not be disregarded in this case?
Yes, Your Honor.
Okay, great. Do you have anything else to submit?
No, Your Honor.
Can you conclude? Can you conclude your your second grounds of appeal, your submission?
Sure, Your Honor. Thank you, Your Honor. Your Honor. Hence, by referring to all circumstances, the second respondent had vicariously liable for the act of the first defendant under the doctrine of non-delegable duty of care. Your Honor, according to the foregoing reasons, we will submit our prayer for relief. The appellant respectfully requests this honorable court to adjudge and declare to set aside the session court's decision and help the respondents are liable in negligence, as there is sufficient causation between the failure to advise of the risk of the bladder cancer and the brain damage suffered by the appellant. In addition to that, the appellant also respectfully requests this honorable court to compensate the appellant for the special damages as she needs to incur a huge amount for her medical treatment and general damages as she lost of earning capacity. Your Honor, without further argument, I raise my case. Thank you for your time and indulgence.
Thank you, second counsel. Okay, respondent.
My lady, may I begin?
Yes.
Much obliged, my lady. Good evening, my lady. May it please this honorable court. My name is Nur Aisha Soleha binti Zainal Abidin, appearing as the senior counsel on behalf of our client, Dr. Kevin Lai and Nilai SMX Medical Center. Appearing together with me today is my learned co-counsel, Nur Amanin Husna binti Muhammad Nasir. My lady, we wish to put forward 4 arguments. I will be dealing with the first and second issue within 70 minutes, and the remaining submission will be did by my learned co-counsel for another 20 minutes. We will also reserve 5 minutes for the rebuttal session. My lady, before I proceed, do you lordship need assistance on the facts of the case?
No, just proceed with the submission, please.
Much obliged. My lady, there are 4 issues to be submitted before this honorable court. First, the respondent does not breach on his duty of care towards the appellant. Second, the appellant failed to exercise reasonable care for her health and contribute to her own damages. Third, there are no sufficient causations between respondent's actions and the injury of the appellant. Last issue, like Assam's Medical Center does not have vicarious liability towards the appellant. My lady, as such, I will divide my first issue into 2 parts, which are, first, the treatment provided to the appellant had been given in accordance with standard of care. Second, Dr. Kevin is not liable for the delay in referring the diagnosis to the specialist. My lady, if there is no further question needed by the bench, may I proceed with the first issue?
Yes.
Much obliged, my lady. My lady, for the first issue, we submit that the first respondent does not breach his duty of care towards the appellant. On the first count, we submit that the treatment provided to the appellant had been given in accordance with standard of care. First, the High Court in Abdul Ghafur bin Muhammad Ibrahim and Pengarah Hospital Kapal Batas and another decided that the act of the defendant is reasonable based on the standard of a reasonably competent or skilled person. Second, further discussion in regard to the standard of care for diagnosis or treatment can be seen in the volume test as expounded in Volume and Friar Hospital Management Committee. Using the volume test, the majority of the House of Lords held that the doctor had not breached his duty of care because other reasonable doctors would have acted in the same way. My ladies, we submit that under the first respondent's circumstances, he had performed the general and approved practice in the situation before him. He only has to conduct a reasonable standard of care and skill to treat his patient. Furthermore, although CT scan had been conducted in July 2019, after the consultation with the first respondent, there were no signs that the disease had spread to the other organs. This clearly shows that during the examination by Dr. Kevin, he cannot be diagnosed as a primary progressive MS as there are no other abnormalities. Hence, we submit that it is not compulsory for him to exercise the highest or very high standard as it was given within the acceptable standard of his practice.
Counsel, if I may stop you there. However,
Yes, my lady.
in the statement of facts, it says that Dr. Kevin is a medical consultant. So what is actually a duty of a medical consultant if he is not to give any referral or any advice or any further treatment to Amrita once he had considered Amrita to have a secondary progressive multiple sclerosis? How can you?
Thank you, my lady, for pointing that out. My lady, according to official circular letter of the Director General of Health Malaysia, Bill 3, 2002, the official title for experts, the medical consultant means a specialist or senior doctor who can practice independently in his field. And my lady, may I be given a moment?
Okay.
Thank you, my lady. My lady, in mood problem clarification, Dr. Kevin medical expertise or job was left silent. However, referring to the mood problem page 1, paragraph 2, Dr. Kevin was a surgeon and the independent medical consultant who specialized or expert in MS. We argue that he expert in MS as the appellant who in the first place suffered MS, primarily seeing Dr. Kevin for further consultation on MS and also to manage the MS surgery along with the medication. According to British Medical Association, consultants are senior doctors or specialists that have complete full medical training in specialized area of medicine and are listed in the General Medical Council register. My lady, may I proceed?
Okay. Proceed.
Thank you, my lady. The second ground under this issue is we submit that the first respondent is not liable for the delay in referring the diagnosis to the specialist. If I may bring this honorable court's attention to the relevant provision and cases that I will highlight throughout my submission. First, Section 12 of the Medical Act 1971 stated that a person is entitled to be provisionally registered as a medical practitioner as he holds the qualification granted by an institution of the second schedule. Second, as I mentioned earlier, according to the official circular letter of the Director General of Health Malaysia, Bill 3 2002, official title for experts, the medical consultant means a specialist or senior doctor who can practice independently in his field. Third, subjected to Part 2 of the Code of Professional Conduct 2019, the primary practitioner, who is the practitioner first seeing the patient, may manage the patient himself accordingly. Second, in the case of Dr. Chin Hyun Hiep versus Ng Oo Kun and others, the Court of Appeal held that the appellant, who is a medical consultant, was not negligent after considering that the standard of care expected of a medical practitioner. The judge further explained that a medical practitioner is not required to exercise a very high standard, but fair and reasonable as practiced by other practitioners at the same level. My lady, the last ground for my submission concerning the second sub-issue, we submit that as for the first respondent, he may manage his patient according to his standard manner and qualification that he had as a medical consultant. As such, my lady, yes, my lady.
Just now you mentioned Bolam test.
Yes, my lady.
Why do you use Bolam test?
My lady, may I be given a moment?
Yes.
Thank you. My lady, Bolam test is applied for a test in cases of medical negligence for standard of care of a doctor or medical practitioner.
Is there any other test rather than Bolam test?
Yes, my lady. There are Roger versus Whitaker test.
What about that? It's not applicable in this case.
Okay. Thank you, my lady, for pointing that out. The Bolam test was considered and broadly confirmed in Sideway and Board of Governors of the Bethlehem Royal Hospital and the Mosley Hospital and others. It's in the Fufuna, if I may bring this honorable courts to the Fufuna's case, from the judgment, it is proven that Bolam test is applied as federal courts decisions in case of medical negligence. Pertaining to duty to doctors to advise the patient on the risk of proper treatment. However, different from the Bolam test, Roger versus Whitaker. In Roger versus Whitaker test, it's the Australian court rejects the notion that a doctor could not be found negligent in warning a patient so long as the doctor act within the purview of a common practice. The determination of standard of care in this case shifted from being determined by the body of medical professionals to one of judicial determinations. Means Roger versus Whitaker test was applicable to determine standard of care to advise the patient of risk by a doctor, and the determination in this test was shift from the medical professionals to judicial determinations.
Okay.
My lady, may I may I proceed?
Yes.
Thank you, my lady.
Okay.
My lady,
Mm-hmm.
we submit that the respondent does not breach on his duty of care towards the appellant. It is undeniable that the first respondent is supposed to establish his standard of care to his patient as a medical consultant. However, my lady, since the first respondent had carried out his responsibilities as a specialist by making diagnosis, treatment, consultation, and even surgery on Amrita within 5 months, his acts are in line with the ordinary standards of other medical consultant or specialist. He has performed his obligations by informing the appellant about the risk of the disease and setting up appointments with her for additional treatment within that 5 months. Therefore, we did submit that he is not liable for delay of the referral to another specialist because he could manage the patient himself. will also submit regardless how chronic MS disease is. He already, yes, my lady.
What do you mean that he could manage the patient himself?
My lady, thank you for pointing that out. My lady, according to Part 2 of the Code of Professional Conduct 2019, the primary practitioner, who is the practitioner first seeing the patient, may manage the patient himself accordingly or refer to the other specialist. It means that it is an option for Dr. Kevin to choose whether to treat the patient himself or to refer the patient to another specialist.
That means he is escaping from his liability as a medical consultant, right? Because if you can see in the statement of facts, it does not have, or it does not provide any statement saying that he was making a referral to other specialists, or he is passing over the diagnosis to other medical practitioners to attend to Mrs. Amrita. Basically, he did nothing. Don't you think that he had already committed a medical negligence on its own? I mean, from the very first part, from the very beginning, he considered that Mrs. Amrita had a MS, had a secondary MS. How do you respond to that?
My lady, may this honorable court rephrase the question?
Sorry?
May this honorable court rephrase the question?
Okay. Because just now you mentioned a case, you cite a case that a specialist can, it is an option for the specialist to refer the patient to other medical practitioners, but it does not happen in this case. So if I may have to distinguish the principle or the facts in that case to our present case at the moment, is neither if you say that Dr. Kevin has an option, he even in the first place does not execute his duty as a medical consultant, because basically he did nothing in here. And not only that, he also had not only he had breached his duty of care, but also he had committed a medical negligence by not referring the patient, Mrs. Amrita, to any other specialist, given the fact that he has an option, just like the case that you mentioned before. Because I'm using the principle or the facts of the case that you presented before me.
Miss Melody, thank you for highlighting that matter. Melody, Dr. Kevin subjected to Part 2 of the Code of Professional Conduct 2019, Dr. Kevin chose to manage the patient himself accordingly with his qualification as a specialist on MS area, my lady. And referring to the mood problem, page number 1, paragraph 2, the first respondent had carried out his responsibilities as a specialist by making diagnosis, treatment, consultation, and even surgery on Amrita within 5 months. His act in line with the other ordinary standards of other medical consultant or specialist. He has performed his obligations by informing the appellant about the risk of the disease and setting up appointments with her for additional treatment and consultation within that 5 months, my lady.
Where is it?
In referring to the mood problem, page number 1, okay. Paragraph 2.
Paragraph 2. Okay.
My lady, having finished with the first issue, does this honorable court miss any further clarification before I continue to submit on the next issue?
No.
Much obliged. My lady, having finished with the first issue, I will now move on to the second issue with this, which is the appellant failed to exercise reasonable care for her health and contribute to her own damages. I will divide my submission into 2 grounds, which are: first, the appellant did not seek for early treatment in regard with her illness. Second, the appellant does not continue the treatment with Dr. Kevin after 5 months the diagnosis had been done.
Okay.
My lady, if there is no further questions, may I proceed with my submission?
Yes, please.
My lady, first, by virtue of Section 12, subsection 1 of the Civil Law Act, When a person suffers damage as a result of his own fault and the fault of another person, the damages recoverable in that case are reduced to the degree that the court considers just and equitable. My lady, on the first ground, we submit that the appellant did not seek for early treatment in regard with her illness. That I may bring this honorable court's attention to the relevant provision that I will highlight throughout my submission, as can be seen in the case of Ahmad Taufik Amzar Ahmad Zuzairi and Kuala Terengganu Specialist Hospital Sindar Berhad and others. The High Court found that the plaintiff parents contribute to his own negligence due to the tardiness to bring the plaintiff to the hospital. It has caused infection to the abscess. As a result, the patient suffers permanent disabilities. The learned judge further justified that the plaintiff parents' inability to bring the plaintiff to the hospital during office hours due to their work's obligations is such an unreasonable excuse. Second, based on the case Jones and Liver Quarries Limited, a person is guilty when he should have reasonably foreseen that if he did not take a reasonable action like a prudent man, he would be injured with his own action. In this instance, by the first time the symptom first appeared, it should have been a concern for the appellant to seek early treatment, and the MS symptom could be diagnosed and proper measure could be taken. She should foresee that the symptoms of her illness, such as the numbness, could possibly lead to more severe pain if she does not seek treatment for herself. Unfortunately, my lady, the appellant did not take any active step to seek for medical care treatment within the 9 months prior to her first consultation with the first respondent when the symptoms occurred. My lady, as for second ground under this issue, we submit that the appellant does not continue the treatment with Dr. Kevin after 5 months the diagnosis had been done. The appellant should have continued the treatment, but she did not attend any treatment after 5 months consults with the first respondent. Moreover, when she followed her husband to move to Sandakan, it made even more difficult for the first respondent to continue to keep in touch with the appellant or even arrange further investigation or rehabilitation. Thus, we submit that the appellant's delay to seek for her treatment had worsened the appellant's condition and negligently contributed to her own damages. Hence, had the appellant continued receiving the treatment, her condition could be better. We submit that it is clear that it was not Dr. Kevin's fault in the first place.
Okay.
My lady, having finished with the second issue, does this honorable court... Yes, my lady.
Your time is up.
My lady, may I be given an extension of time?
1 minute, please, to conclude your words.
Thank you, my lady. My lady, having finished with the second issue, does this honorable court need any further clarification?
Right here. No.
Much obliged. If there is no further assistance favored by this honorable court, that shall conclude my submission on the first and second issue. Thank you, my lady, for your time and indulgence.
Welcome.
My lady, may I begin?
Yes, please.
Much obliged. Good evening, my lady. May it please this honorable court. My name is Nur Amalin Husna binti Muhammad Nazir, appearing as the junior counsel on behalf of the respondent. My lady, having finished with the first and second issues submitted by my co-counsel, I will now move on to the third and fourth issue, which are there are no sufficient possession between first respondent's action and the injury of the appellant. And the fourth one, SMX Nilai Medical Center does not have vicarious liability towards the appellant. Each of the issue will be submitted has a ground, which is for the third issue, the injury would still occur whether the first respondent treated the appellant or not. And for the fourth issue, there is no employer-employee relationship between SMX Nilai Medical Center and Dr. Kevin. My lady, if there is no further question needed by the bench, may I proceed with my submission?
Yeah.
Much obliged. My lady, for the third issue, we submit that there are no sufficient causations between the first respondent action and the injury of the appellant. My lady, I will submit the issue based on the ground that the injury would still occur whether the first respondent treated the appellant or not. If I may bring this court's attention to the relevant cases that I will highlight throughout my submission, In the case of Government of Malaysia and others, and Jumat bin Mahmud, the Federal Court said that even if the appellant had provided sufficient supervision, still the injury would have taken place. Therefore, the appellant was not liable due to lack of causation between the first respondent's damage and the appellant act. Further discussion can be seen in the case of Barnett and Chelsea Kensington Hospital Management Committee. The judge held that the defendants were not liable to the plaintiff because of the husband's death was not caused by their negligence. Even if the husband had been treated by the defendants, he would still have died from poisoning. Consequently, the doctor's negligence was not the cause of the defendant's death. Focusing on there is no cure for the...
Hello?
Yes, my lady.
So you're trying to disregard that Dr. Kevin was not negligent in this case? And even if he is found negligent, according to the principle of the case that you cited before, that even if Dr. Kevin was negligent, it was still cannot be regarded as the cause of the effect of appellant in this case. You're saying so?
Yes, my lady. However, regarding the injury of the appellant, which is Amrita, she suffered a uncurable disease, which is the MS, multiple sclerosis, whereby if we refer to the Dr. Sharon, he said that MS MS has no cure, and even with the treatment or medication, is only to help to reduce the chance of development of new symptom. Yes, my lady. Have I addressed your concern, my lady?
So are you trying to make an assumption that the appellant cannot be saved still, even if there was a treatment given by Dr. Kevin? Isn't that sound barbaric in the sense of humanity? So you're saying that as long as the appellant was not found dead, so it's okay if Dr. Kevin was negligent, are you saying so?
Yes, my lady. However, if we may refer to the mood problem, in the paragraph 7, Dr. Azran, Professor Dr. Azran said that the chance of remission was only 40%, whereby
there is a chance, but there is a chance still. There is a chance of continue her living. There is a chance that probably if the referral was made earlier by Dr. Kevin to other specialists, there is a high chance or high probabilities of the appellant to live more and also to continue her living and also to exercise her daily job. Right?
Yes, my lady. Indeed, my lady. However, if we may refer to textbook of Jackson and Powell of Professional Negligence, 4th edition, at the page of 719, it was said that if the chance that proper treatment would have secured the desired result was less than 50%, the plaintiff cannot prove on a balance of probabilities that the damage will not have occurred in any event. Therefore, the balance of probability should be proven 50%. However, Amrita have only 40% chance of remission. Have I addressed your concern, my lady?
Yes. Proceed.
Much obliged, my lady. My lady, in this instance, the chance of survival that declined to 25% is not due to the action of the first respondent who did not refer the appellant to the specialist and not caused by the first respondent's act from the start, as the appellant's injury would still occur. My lady, therefore, we submit that there are no sufficient causation between the first respondent's action and the injury of the appellant, since the appellant's injury would still occur whether the first respondent treated the appellant as primary progressive MS or not. My lady, having finished with the third issue, does this honorable court need any future clarification?
No.
Much obliged. If there is no further existence favored by this honorable court, then I will continue with the fourth issue. My lady, for the fourth issue, we submit that SMX Nilai Medical Center does not have vicarious liability towards the appellant. I will submit the fourth issue based on the ground that there is no employer-employer relationship between SMX Nilai Medical Center and Dr. Kevin. Accordingly, if we may refer to the case of Dr. Kok Chung Sang and another, and Su Cheng Lin and another appeal, the federal court applied the first stage of the test in vicarious claimant and Catholic Child Welfare Society and others, whereby the test is to determine the nature of the relationship between the hospital and the medical practitioner. The respected judge summarized that akin to employment are now included in the scope of vicarious liability in addition to employer-employee relationship. Hence, the court held that the relationship between the hospital and the doctor was not sufficiently akin to employment for the hospital to be vicariously liable of a tortious act of the independent medical practitioner.
Counsel, what is the elements of vicarious liability? What are the elements?
Thank you, my lady. In order to determine the relationship of the employment, there must be established a relationship which is akin to employment and the element of control. Yes, my lady. Have I
So
addressed your concern, my lady?
if I may clarify your submission, you're saying that the elements of vicarious liability is the existence of employer-employee relationship.
Yes, my lady.
Is it here? Is it established here? You mentioned about agreement. Did you mention about agreement?
Yes, my lady.
But there's no such agreements in this in the current situation. How can you assume that they are an employer-employee relationship? If you read the statement of facts on paragraph 2, it says that Dr. Kevin is an independent medical consultant. So how would you say that he has a special employer-employee relationship with the SMX Medical Center, a private hospital? Can you come up with any authorities that even if a party was an independent, categorized as an independent, therefore he also happened to have the employer-employee relationship?
Yes, indeed, my lady. If we may refer to the moot clarification, it was stated that
Which page? Which number?
number 5, my lady.
Number 5. Okay, he is not attached to the medical center as a doctor. Why is paragraph 2, number 5?
Yes, my lady.
Why is getting regarded as an independent? Because he is not attached to the medical center as a doctor. Okay, and then?
Yes, my lady. If we may refer to the if we may refer to the Private Healthcare Facilities and Service Regulation 2006, in the Regulation 395, subsection D, a patient family must be under the care of a registered medical practitioner who shall be responsible for the medical care service. Which means that the function of a private hospital in Malaysia is merely to provide hospital facilities and not the medical service. Whereby, in this instant case, Dr. Kevin is an independent practitioner and not attached with the hospital as a doctor, but he is an independent doctor. Therefore, according to this regulation, it is clear that an independent doctor in a private hospital shall be responsible of the medical care service and not the hospital itself.
Okay.
Thank you, my lady. If I may continue to my next submission, According to Tan Eng Siu and another, and Dr. Jarjit Singh Sindhu and another, the independent medical consultant, though he was worked to the second defendant which is the private hospital, it was only an arrangement to use second defendant's facilities. Therefore, which means that everything that hospital propose have no control over the independent doctor. Thus, the hospital has no right to control the doctor, give an order regarding the treatment, as the doctor is an independent practitioner. In other case, was stated in Ki Boon Swan and others, and Adventist Hospital and Clinical Service and others, held that the hospital was not vicariously liable for the alleged negligence of the doctors. The contract between the parties clearly showed that the respondents were the independent contractors and not agents or employees of the hospital. My lady, in the present case, it is clear that Dr. Kevin, in his contract with SMX Nilai Medical Center, as an independent consultant that free from any control or interference or obstruction from the hospital management. As such, my lady, would submit that SMX Nilai Medical Center does not have vicarious liability towards the appellant, because there is no special relationship akin to employment between Dr. Kevin and SMX Nilai Medical Center, as Dr. Kevin is an independent consultant. My lady, having finished with the fourth issue, does this honourable court need any further clarification?
No.
Much obliged, my lady.
Okay.
In the light of submission made above, the respondent humbly requests this High Court to adjudge and declare that the first one, Dr. Kevin had performed his duty of care towards Amrita according to the standard applicable in medical practice. The second one, Dr. Kevin does not have to make any referral to other specialists since he is a medical consultant himself. The third one, Amrita is liable for contributory negligence as she failed to exercise reasonable care for her own health. The fourth one, there is no special relationship akin to employment between Dr. Kevin and SMX Nilai Medical Center. And the last one, SMX Medical Center is not vicariously liable for the tortious act of the independent medical practitioner. If there is no further existence favored by this honourable court, that shall conclude my submission on the remaining issues. Thank you, my lady, for your time and indulgence.
Thank you.
Thank you, my lady.
Okay. So, Meili?
Attendant, you can continue with your rebuttal.
I forgot that there is the rebuttal and rebuttal session. I thought that we have already dispersed. Okay.
Good evening, Your Honor. Am I audible?
Yes.
Thank you. May it please the court. My name is Ainin Sofia Binti Azlaini, and I represent the appellant, Mrs. Amrita. With the court's permission, we would like to reserve some time for rebuttal. This case is on appeal from the session court. The session court denied.
Reserve what?
We would like to reserve some time for rebuttal.
Sometimes for rebuttal. Just say how many minutes you want. Don't say sometimes, just say how many minutes you would like to reserve for rebuttal.
Thank you for your concern, Your Honor.
Mm-hmm.
Shall I proceed with my submission?
Yes, your rebuttal submission. Okay.
Your Honor, we have 2 points of rebuttal to raise. Firstly, the senior counsel from the respondent focused the court's attention that the respondent has fulfilled the standard of care by conducting the treatment with reasonable care and skill. However, my learned friend omitted one very important point. In Ahmad If I may assist the court, in Ahmad Takif Amzar bin Ahmad Huzairi and Kuala Terengganu Specialist Hospital Sendirian Berhad and others, the defendant failed to refer the seriousness of the plaintiff's condition to the specialist and resulted to worsen the plaintiff's condition. By looking in this current situation, it is crystal clear that the respondent did not exercise the treatment in accordance with the standard of care. If I may assist the court according to the mood problem paragraph 7, if there was no delay in referral, the appellant will have 40% chance of remission. Furthermore, he has the knowledge that the numbness will lead to the secondary progressive multiple sclerosis, as the multiple sclerosis is at high risk to suffer bladder cancer and brain damage. And Mrs. Amrita, as a reasonable, can take necessary treatment to treat her condition. To add more, the disease is a rare disease as mentioned in our mood problem paragraph 4, and it is under the first respondent duty to verify and refer the specialist for the confirmation and make further investigation. If I may assist the court by referring to the Code 1.2.1 of Code of Professional Conduct 2019, it mentioned that in conformity with his own sense of responsibility, a medical practitioner should arrange a consultation with a colleague. Thus, we submit that the first respondent has breached his standard duty as medical consultant. Secondly, the junior counsel for the respondent stated that the second respondent does not vicariously liable on the act of the first respondent and as the first respondent as an independent medical consultant and lead to the absence of the employer-employee relation. Nevertheless, little did we know that in Datuk Bandar Dewan Bandaraya Kuala Lumpur and Kok Peng and another, although the task was under the control of the independent contractor, the employer was still not free from the responsibility of ensuring safety and health in the workplace. By applying to this current case, the doctrine of non-delegable duty shall prevail, as the second respondent has power to control and ensure that the treatment is done accordingly. Your Honor, without further argument, I rest my case. Thank you for your time and indulgence.
Okay. Respondent?
My lady, may I begin?
Yes.
Thank you, my lady. My lady, I have 4 quick points to make. First, the learned counsel have contended that in the case of Risha Taranjit Kaur, the doctor has duty to advise and provide necessary information to his patient in order to assist the patient make an informed choice of treatment to the patient's medical conditions. The learned counsel submitted in their memorial page 2, paragraph number 7, that the first respondent did not give any advice or necessary information about the numbness may be symptom of secondary progressive MS as suspected by the first respondent himself. However, my lady, we submit that this is not the case. By referring the case to this honorable court in Elizabeth Chu and the Government of Nation and another, the High Court has highlighted that a practitioner cannot be considered negligent if he follows the well-known route. In the present case, the first respondent has arranged consultation with the appellant and it speeds all procedures including diagnosis, advice, discussion on MS disease, medication, and even surgery are given according to the procedure as a qualified person in the field within 5 months as stated in Mood Problem, page 1, paragraph 2. In the case of Dr. Chin Hyun versus Ng Oh Kun and others, the Court of Appeal had that the appellant, who is medical consultant, was not negligent after considering the standard of care expected of a medical practitioner. The judge further explained that a medical practitioner is not required to exercise a very high standard but fair and reasonable as practiced by other practitioners at the same level. Second, my lady, the learned counsel on their memorial page 1, paragraph 2 also assists this honorable court by referring to volume test will be applied in order to determine the standard duty of care that our doctors owes in a general standard of care. They further explain in their memorial that the relationship between doctor and patient signifies that the duty of care owned by the doctor, which includes the duty to diagnose, advise, and treat his patient. However, my lady, according to Fifina's case, the federal court held that the volume test has no relevance in determining the general standard of care of a medical practitioner in a relation to the advice or disclosure of information and risk. Thus, applying the volume test generally to all cases of medical negligence would likely to lead to difficulties for patients to establish their cases. The volume test still applicable, but only in issues pertaining to the duty of doctors to treat and to diagnose and not covers all standard of care. My lady, third, the second feature of non-eligible duty of care is not present in this instant case. The Learned Council submitted on their memorial at page number 7 under the second issue that second respondent has special duty on the appellant under the doctrine of non-eligible duty of care. However, Yang Arif, we submit that this is not the case. We argue that the doctrine of non-eligible duty of care cannot come into existence when the employer-employee relationship between Dr. Kevin and the SMX Medical Center are still uncertain. According to the case of Dr. Koh Chong Seng, the feature of non-eligible duty of care was not satisfied since the hospital has never assumed positive duty to protect the plaintiff from any injury. The judge held that the non-eligible duty of care is not imposed based on the relative vested interest, nor does it depend on the terms of the relationship between the defendant and the person, which is the patient. In regards to the patient-hospital relationship, it was never been established due to the circumstances surrounding the plaintiff engagement of Dr. Cox and admission to the hospital. My lady, the last rebuttal points that I want to highlight in this case is the Learned Co-Counsel on behalf on the appellant highlighted that in page number 2, paragraph number 7, the delay of the referral, their delay of referral was made in this present case. However, my lady, we submit that this is not the case. Professor Dr. Azlan, a pathologist from Seremban Specialist Center, only told that there are delay in the referral, and there are delay in the referral to this instance case, but not made by the Dr. Kevin. We argue and we submit that the delay of referral was made by the patient herself, which is her contributory negligence to seek for early treatment at the first stage of numbness appeared before the first consultation, 9 months before the 9 months before the first consultation with Dr. Kevin. My ladies, if there is no further assistance needed by the bench, that shall conclude my rebuttals on behalf of the respondent. Thank you, my lady, for your time and indulgence.
The Honorable Court is now adjourned. Participants are to exit this breakout room by clicking Leave Breakout Room button and enter the main room to allow the judge to fill up the score sheets in this room. And to add, we will have a 15-minute break for Zuhur prayer.
So am I ada participants leave?
Yes, participants only.
Okay, so I can fill in the score sheet lah, right?
Yes, you are welcome to fill up the score sheet. And if I may, I wish to remind you that the time allocated for this is 10 minutes.
Okay.
And if any question you may ask, I will assist you.
All right.